Okay, welcome to the deep dive. Today, we are really getting into something vital, understanding pain in our pets.
It's a huge topic.
Right, we've been digging into some great sources, mainly this really detailed veterinary text excerpt. We want to unpack how the experts actually define pain, how they spot it in animals who, can't just tell us,
Hmm.
and then what they do about it. Our mission here is to pull out those core insights, things that might really change how you, the listener, look at your own pet.
Absolutely, because like you said, they can't use words. I hurt, they just can't say it.
Exactly.
And that silence, well, it puts all the pressure on us, doesn't it? On vets, on owners. It makes recognizing and managing their pain a real challenge of observation and biological understanding. This source gives us a fantastic look into how vets approach that.
Yeah, it really does. So let's start right there with the basics. How does the source define pain? What is it, really, in veterinary terms?
Okay, so it gives a very specific definition. It calls pain an unpleasant sensory or emotional experience associated with actual or potential tissue damage.
Hmm.
That's what it calls adaptive pain or altered sensory neurobiology. And that second part points towards chronic pain.
Sensory and emotional, that's key, isn't it? And the source immediately follows that up with something that feels like, well, the most important point, maybe.
I think it might be.
Right.
It says straight up, the inability for the animal to communicate does not negate presence of pain and the need for appropriate pain-relieving treatment.
Wow.
Full stop. Just because they're quiet doesn't mean they're okay.
That just lands so heavily. It puts the onus entirely on us, on observation. So, okay, physiologically, how does this unpleasantness happen?
Oh.
The source mentioned nerve ending.
Yes, it starts with what they call noxious stimuli. Think harmful things, a cut, pressure, intense heat,
Yeah.
chemicals. These activate specialized nerve endings. They're called nociceptors, little damage detectors, basically, scattered everywhere in the body tissues.
And they fire off a signal.
They do. They turn that physical event into an electrical signal. That signal zips along sensory nerves towards the spinal cord, specifically an area called the dorsal horn. You can think of that as a major hub, a relay station for incoming sensory info.
Okay, so injury, signal travels, hits the spinal cord relay. Where next?
From there, ascending neurons carry that signal up towards the brain. It goes through the brainstem, eventually reaching the cerebral cortex. And that's where the conscious feeling, the perception of pain actually occurs.
Got it. Tissue damage signal, spinal cord hub up to the brain. Ouch. But you mentioned something happens back at that spinal cord hub. Modulation.
Yes, and this is super important. At that dorsal horn, the pain signal isn't just passed along like a hot potato. It gets modulated. It can be turned up, amplified, or turned down, inhibited. Well, by other sensory information coming in at the same time, or even by signals coming down from the brain, these descending pathways can act like a dimmer switch. And crucially, this modulation point is where a lot of pain medications actually work. They dampen the signal before it gets strongly sent up to the brain.
And this basic wiring, it's pretty similar across different animals.
The source suggests the fundamental pathways, yeah, they're remarkably alike across mammals and even in many non-mammals. But, and this is the big but, how an animal perceives that signal, how they react, that can vary hugely.
Based on what?
Things like their brain development, their past experiences, have they felt this before, learned behaviors, even just their current environment can influence it.
Okay, now this is where my mind was kind of blown reading this. The idea of altered neuroprocessing. This seems to change everything about long-term pain.
It really does. It's the crucial, maybe scary truth about pain that sticks around. If those pain pathways we just talked about, from detectors up to the brain, are firing constantly, maybe because of a chronic injury or ongoing arthritis or nerve damage, the nervous system itself actually starts to change. It physically, chemically gets rewired. This is called sensitization.
Sensitization, like it becomes overly sensitive.
Exactly like that. The volume control for pain gets cranked way up, so you get hyperalgesia. That's where something that should hurt hurts way more than it should.
Okay.
And maybe even more weirdly, you can get allodynia. That's when something totally harmless, like a gentle touch, maybe just petting your cat, actually becomes painful.
Wow.
This rewiring, this altered state, that is maladaptive pain, chronic pain. It's stopped being just a useful warning signal. It's become a disease of the nervous system itself.
So the pain isn't just happening to them, it's actively changing their nervous system. What else does this kind of ongoing pain do to an animal's body? It's not just about feeling bad, right?
Oh, far from it. Pain can start in any tissue, like we said, even the nervous system, but its effects ripple outwards. The source notes it can weaken the immune system, make the body break down its own tissues more, that's catabolism, crank up stress hormone levels, and obviously lead to loss of function. They stop using that sore leg, for example.
And a huge challenge for vets and owners is that animals just react so differently. The source talks about a lot of variability.
Oh, massive variability, how an animal shows pain, how bad it seems, even how their nervous system changes in response. It's influenced by so much. Their age, their sex, their breed. Think stoic breeds versus more expressive ones.
Yeah.
Their past experiences matter. Their environment plays a role. And yeah, the source even mentions genetics can tweak how they respond or show pain behaviorally. It's complex.
The source makes a distinction between acute pain and chronic pain. Is that initial acute pain ever useful?
Well, in a basic evolutionary way, yeah. That's adaptive pain, physiologic pain. It's the quick, ow, that makes you pull your hand from a hot stove. It teaches the animal, don't step there again.
It's protective. But what about pain that hangs around after something like surgery? That's acute, but persistent.
And that's a critical difference the source draws. That initial surgical pain is acute, sure. But if it's not managed and it just keeps going, it offers zero benefit. It's just suffering.
And potentially leads to bigger problems.
Exactly. Persistent, uncontrolled acute pain is a major risk factor for developing that maladaptive chronic pain state we talked about, that wind-up where the nervous system gets sensitized. And the source couldn't be clearer. Any form of chronic pain syndrome, that maladaptive state. It never serves a protective purpose. It always needs treatment.
Which brings us right back to the core problem for owners. How do we even know? How do we recognize the signs if they can't tell us? What does the source suggest we look for?
This is all about careful observation, being a detective, and knowing that the signs can be all over the place.
Right.
The source really stresses how much things like the animal's experience, their environment, their age, their species, how much all that changes the picture. A cat often shows pain very differently from a dog. A prey animal might hide it instinctively.
Okay, so give us some examples the source mentions. What are the more obvious signs?
The obvious ones are often what you'd maybe expect. Vocalizing, whining, crying, maybe growling if you approach, being restless, agitated, holding themselves funny, like hunching their back.
Limping.
Definitely. An abnormal gait, a limp, maybe thrashing around if it's really severe, or flinching really dramatically if you touch a sore spot that's hyperesthesia or hyperalgesia.
And the less obvious signs, the subtle ones.
These are the tricky ones. Things like trembling, just being really lethargic, not wanting to move, eating less, seeming kind of dull, maybe even stuporous. Or sometimes behavioral changes becoming suddenly bitey or aggressive when they weren't before. That could be fear of pain.
What about those classic stress signs? Fast breathing, heart racing, big pupils. We often think those equal pain.
Another really crucial distinction the source makes. Tachypnea, fast breathing. Tachycardia, fast heart rate. Mydriasis, dilated pupils. Hypertension, high blood pressure. These are signs of the body's stress response. And yes, pain is stressful, but these signs are non-specific. An animal might show them just from being scared at the vet clinic or uncomfortable in a bandage. They don't automatically mean pain.
And specifically with chronic pain.
This is key. The source points out that you often don't see that acute stress response with chronic pain. The animal's body kind of adapts over time. So your pet with chronic arthritis might have normal heart rate, normal breathing, but still be in significant pain. That makes it even sneakier.
Wow, okay. That's vital for owners to know. The classic stress signs might be absent in chronic pain. So what should we look for with chronic pain?
The source says the signs are often really subtle. The body's trying to cope, right? Homeostatic mechanisms kick in and can mask things. So you're looking for more gradual general changes.
Like what?
Decreased activity is a big one. They don't want to play as much. Walks get shorter. Maybe a lameness that comes and goes. Or just seeming down, depressed, not their usual bright self. It really boils down to noticing a change from the normal behavioral over time.
Okay, that makes sense. Shifting gears a bit, what typically causes the pain that vets are seeing?
Well, the source mentions the obvious things that cause tissue damage. Trauma, accidents, injuries, surgery, of course, ongoing inflammation, and chronic degenerative stuff like osteoarthritis. That's a huge one.
And when does it flip into that pathologic pain state?
That usually happens when the pain signals just keep firing long after you'd expect the initial injury or condition to have healed or stabilized. It's the sign that the nervous system itself has started processing things differently. That wind-up we talked about.
Who's most at risk?
Well, Any animal having surgery or experiencing trauma is at risk for acute pain, naturally. But the source really flags older patients. They're at much higher risk for chronic pain because degenerative diseases like arthritis just become more common as they age.
Does the severity of the injury always match the pain level?
Not perfectly, no. The source adds that nuance. Sometimes minor-looking things can be surprisingly painful and vice versa. But generally speaking, yeah, more invasive surgeries or really severe chronic inflammation, especially in older pets, you'd expect more significant pain.
So how do vets actually diagnose pain? Is there like a blood test or something?
Nope. And this is another really key point from the source. Pain is a clinical diagnosis. There's no single test that definitively says pain present.
So it's the vet's judgment.
Is the vet's judgment, yes.
Yeah.
Based on everything they gather, the history you provide, the physical exam findings, and crucially, how the animal is behaving. They put all the pieces together and make a clinical assessment. And they document that diagnosis in the record.
And they need to rule other things out first, I imagine.
Oh, absolutely. Is it pain or was it fear? Anxiety? Is the animal just uncomfortable because of a bandage that's too tight? Or maybe stressed from being handled? It can be tricky.
Especially with medication.
Right. Because some of the drugs used for pain, particularly strong opioids or certain anesthetic agents, can sometimes cause side effects like dysphoria, the state of unease or agitation, that can look confusingly like the animal is distressed or still in pain.
What about using lab work, blood tests, or x-rays?
They can provide context, but they don't diagnose pain itself. The source notes that acute stress might cause some changes on blood work, like a stress leukogram or high blood sugar, but those are just general stress signs.
And normal labs don't rule out pain.
Absolutely not. That's critical. Normal blood work does not mean the animal isn't hurting.
And imaging, x-rays, MRI.
Imaging can definitely show underlying problems, like arthritis in a joint, which could be the source of pain. But again, the source is really clear. What you see on the x-ray doesn't always match how much pain the animal feels. Some pets have terrible-looking joints but seem okay. Others have minimal changes but are clearly suffering.
So it really comes down to the vet's assessment. Can you walk us through that process? How do they put it all together?
Sure. The source outlines it pretty well. It starts with gathering information. The signalment, breed, age, sex. A detailed history from you, the owner, about the changes you've seen at home. Then a thorough physical exam.
Observing behavior is key too.
Very key. The vet will often watch the animal first from a distance. How are they standing, moving, breathing? Then they'll observe during interaction as they approach and handle the pet. They might gently palpate, feel the areas they suspect are painful, watching very closely for any reaction, flinching, tensing up, turning around.
And maybe the most telling thing, seeing how they respond to pain meds.
Yes. This is maybe the most powerful diagnostic tool for pain specifically. Give an analgesic, then reevaluate. Did the signs improve? If yes, that's strong evidence pain was the issue. The source explicitly warns vets, do not assume administration of an analgesic will result in acceptable relief. You have to go back and check. Assess the response.
Is the goal always zero pain, complete elimination?
That's a great question. The source brings some nuance there. Sometimes getting to zero pain might require such high doses of medication that the side effects become unacceptable. So often the goal is more about making the pain tolerable, improving their quality of life, managing the discomfort, even if it's not completely gone.
Okay, so pain's diagnosed, severity assessed. What are the treatment strategies?
Well, number one, if you can, you treat the underlying cause, fix the fracture, manage the arthritis. But alongside that, you manage the pain itself. The specific drug choices really depend on the species, how bad the pain seems, and what's causing it.
But it's not just about drugs, is it? The source listed a lot of other approaches.
No, definitely not just drugs. There's a whole range of non-pharmacologic and adjunctive treatments. Things like acupuncture, physical therapy, actual prescribed exercises, regenerative medicine like stem cells or PRP injections.
What else?
Manual therapies, massage, chiropractic adjustments, supportive bandages or braces, hydrotherapy, swimming, or underwater treadmill. Weight loss is huge, especially for joint pain. Special diets, and various supplements or nutraceuticals. These can be incredibly helpful, especially for chronic pain.
The source also puts a big emphasis on educating the owner. Why is that so critical?
Because you, the owner, are the one seeing the pet most of the time, especially at home. The vet has to explain what signs to look for to judge if the medication is working. And just as important, what potential side effects to watch out for.
And setting expectations.
Yes, managing expectations is key. The source points out that effectiveness varies a lot between individuals. What works great for one dog might do nothing for another, so you might have to try different drugs or combinations. It's very individualized.
Because of that neurobiology stuff.
Exactly, that complex wiring. The source even suggests giving owners simple pain scoring tools they can use at home to help track how their pet is doing, particularly with chronic conditions.
What about surgery for the pain itself?
Well, surgery to fix the cause of the pain is often the best bet, like repairing a torn ligament. The source mentions procedures to actually cut nerves neurectomy, but says they're rarely done in pets. The results are unpredictable, and sometimes it can even make the pain worse.
And then there's the really tough conversation, euthanasia.
Yeah, the source does address that very soberly. It acknowledges that if you've tried all the reasonable options and the animal quality of life is still poor because of uncontrollable pain, then euthanasia might be the kindest, most humane decision.
Okay, let's dive into the medications themselves. The source mentions several key classes. Opioids first.
Right. Opioids are kind of the workhorses, especially for acute pain, like moderate to severe pain right after surgery. The source breaks them down into the full mu agonists. Those are the stronger ones, like morphine, hydromorphone, fentanyl.
Okay.
And then the partial agonists or agonist-antagonists, like buprenorphine and butorphanol. Those are generally for more mild to moderate pain levels.
How are they typically given to pets? Pills?
Often not pills? No. Many don't absorb well orally in pets, so frequently given by injection or sometimes through a skin patch like fentanyl. The source says they're safe in cats, but usually need lower doses than dogs. One thing to watch for is potential dysphoria, that agitation or unease, which might need a separate tranquilizer sometimes.
What about NSAIDs? Those feel like the most common ones for long-term pain, especially in dogs.
Absolutely, non-steroidal anti-inflammatory drugs. They're the mainstay for chronic conditions like osteoarthritis in dogs. They can be safe for long-term use, but, and this is important, there are potential side effects.
Like what?
GI problems, ulcers, irritation, liver issues, kidney issues. That's why the source strongly recommends periodic blood tests, checking kidney and liver values for pets on them long term. And the goal is always the lowest dose that still works effectively.
And cats are different with NSAIDs.
Very different. This is a huge point the source makes. Cats metabolize them differently. They're much more sensitive to the toxic effects, especially kidney damage. Very few NSAIDs are actually approved for long-term use in cats.
So using them requires extra care.
Definitely. Using an NSAID off-label or extra-label in a cat needs a really careful discussion between the vet and the owner about the risks versus benefits and very close monitoring.
The source also talked about a specific type of pain needing different drugs. Neuropathic pain.
Yeah, that's that pathologic pain we mentioned earlier caused by nerve damage or that altered processing in the nervous system. Signs like allodynia pain from a normal touch or hyperalgesia. Traditional drugs like NSAIDs or even opioids might not work as well for this type of pain.
So what do they use?
This is where alternative or adjunctive drugs come in, targeting different pathways. The source mentions things like certain antidepressants, anti-seizure medications like gabapentin, or drugs that block specific receptors like NMDA receptors. Often these are human drugs used extra label in pets, so again, clear communication with the owner is essential.
Okay, talking risks. What are the big warnings or contraindications for these common pain meds?
For opioids, serious breathing suppression is actually pretty rare in pets compared to humans, but you still need caution if the animal already has severe breathing problems or high pressure inside the skull. They can slow down gut motility, leading to constipation, and sometimes cause urinary retention. And specifically for cats, there's a risk of developing a high fever hyperthermia, especially reported with fentanyl patches and hydromorphone.
And NSAIDs, the big risks.
GI ulcers, liver damage, kidney damage, that's the trifecta. So generally, you don't use them if there's pre-existing disease in those organs or if the animal is dehydrated, really stressed, or not eating well. A huge warning. Never, ever use NSAIDs at the same time as steroids, like prednisone. That dramatically increases the risk of serious GI problems.
Any other NSAID cautions?
Some can affect platelet function, so blood clotting might be slightly impaired, something to consider before surgery. And the source highlights this in bold, practically. Acetaminophen Tylenol, or any product containing it, is extremely toxic to cats and should never be given, period.
So monitoring seems absolutely critical with any of these.
Non-negotiable. You have to monitor closely, both for effectiveness, is actually helping the pain, and for any signs of side effects. And like we said, for chronic NSAID use, that means periodic blood work to check organ function. The vet has a responsibility to make sure the owner knows what to look for.
What about drug interactions, combining these with other meds?
Yeah, the source mentions a few. Opioids can actually lower the amount of anesthetic needed for surgery, which can be useful. But it also warns about combining opioids with other drugs that affect serotonin, things like certain antidepressants, tramadol, trazodone were listed as examples. That combination carries a risk of serotonin syndrome.
And NSAIDs.
We mentioned the big one, never with steroids. Also, be cautious combining NSAIDs with other drugs that could potentially harm the kidneys or GI tract, like certain antibiotics.
The source mentioned those alternative or adjunctive drugs again, beyond just neuropathic pain.
Right. Drugs like gabapentin, amantadine, amitriptyline, tramadol, they're often added on, especially for chronic pain or situations where that altered nerve processing is suspected. The source stresses that vets using these really need to know their stuff, the pharmacology, the approved uses versus extra label, the side effects, how the animal metabolizes it, the right dose. It also loops back to things like regenerative medicine, saying the results can be unpredictable, but sometimes life-changing.
Okay, wrapping up. What about long-term monitoring and prognosis? What should owners expect?
Frequent check-ins on how well the pain relief is working are key, especially early on. For long-term meds like NSAIDs, those periodic blood tests for organ function are standard care. And again, making sure you, the owner, have all the info you need about the drugs.
Can pain actually be prevented?
Well, maybe not entirely prevented if there's an injury, but the source is a big advocate for preemptive analgesia. That means giving pain medication before the painful event, like before the first surgical incision.
Why does that help?
It's shown to provide much better overall pain control and might help prevent or reduce that central nervous system windup, that sensitization we talked about. Using good anesthetic protocols, pre-meds, and local nerve blocks are all part of that preemptive strategy.
And what's the typical timeline? How long should pain last?
For acute pain, say after surgery or an injury, it should generally get better as the tissues heal, usually days, maybe a couple of weeks. The source suggests strong meds like opioids might be most needed right at the beginning, maybe the first day or so, with NSAIDs often taking over or used concurrently as inflammation becomes a bigger factor. And here's a really important flag the source raises. If the pain signs don't resolve within that expected healing time frame, if it lingers for weeks or longer, that's a big red flag. It suggests either the underlying problem isn't fixed, there's a new injury, or those maladaptive changes in the nervous system have really taken hold.
What then?
At that point, the source recommends consulting a specialist, someone board-certified in veterinary anesthesia or pain management, to dig deeper and explore more advanced options.
Wow. Okay. That was incredibly thorough. It really peels back the layers on something we think we understand, but is actually so complex in pets.
It really does. It underscores that pain in animals isn't simple. It takes, a deep understanding. It requires really sharp observation skills, looking beyond the obvious, catching those subtle shifts, understanding the physiology, and then using a whole range of tools for diagnosis and treatment.
And the big takeaways for me, and hopefully for you listening, are things like their silence doesn't mean they're fine. Pain can literally change their nerves. Diagnosis is often about observation and seeing how they respond to treatment. And the goal might be tolerable pain, not zero pain, while always trying to fix the root cause.
Exactly. And knowing that every treatment, every drug has potential downsides and interactions that need careful watching, which makes you such a vital partner in managing it successfully. Your observations are crucial.
So thinking about all this,
Yeah.
how varied the signs are, how much relies on us noticing tiny changes? How does this shift the way you'll observe the animals in your own life? What small changes in their energy, their posture, how they interact? What might jump out at you now that maybe you wouldn't have clocked before? Something to think about.